All right, we're doing scenario 2B. Our patient has episodes of seizures, so we'll get this one going on. Go ahead. All right, so first things first, we're going to survey the scene for any objects or hazardous environmental factors. So we'll get this stuff out of the way. We want to take note of the time that the seizing began or when we first noted the seizing due to the criteria for calling 911. Our patient, if they've been seizing for longer than 5 minutes, if they're pregnant, if they have a history of seizures, or if they're diabetic, this would be an instant call to 911. But if it's under 5 minutes, we can play it out. So we will first approach the patient. I have appropriate PPE on with gloves, and we are going to support their head with a pillow and let them ride out their seizure while we're still taking note of the time. Should they stop seizing, then we would move them into the recovery position. So, I'm going to tip the patient onto their left side. You want to have their knees bent to support them, arm at the side, this arm up also just for support, and then wait this out. We're going to take a time here to check for pulse. Make sure our patient is breathing, feeling for airway coming out of their mouth and or nose. And yeah, we want to make sure that they are done seizing within that 5 minutes, otherwise we'd be calling an ambulance, 911.